Hi, everybody. Welcome to MedPsych Health. I have Dr. Mark Sykes with me again today, and Dr. Sykes specializes in the treatment of anxiety. Dr. Sykes is a colleague at MedPsych Associates, and I've not prepared Dr. Sykes for what I'm going to ask him next, so hopefully he will know what to say. We'll see. Dr. Sykes, I see a lot of kids and teenagers who struggle with anxiety, and can you speak a bit to parents? If they are seeing their children or their teenagers struggle with anxiety during coronavirus, or really, honestly, not just with coronavirus, as you know, we see many teenagers and kids who struggle with anxiety unrelated to coronavirus. But can you kind of just speak to the moment we're in right now where the kids are home, the parents are home, and their kids are struggling with anxiety? What are just some kind of maybe some quick tips and just suggestions that you would have for parents?
Well, to start with, know where your children are at, right? So kind of know their age and developmental stage and get a sense of what do they understand. Talk to them. Communicate with them about how they're feeling and ask open-ended questions like, how are you feeling? So I recommend, kind of avoiding asking leading questions. So like, are you anxious about this? Are you anxious about that? I actually recommend that kind of parents take a step back. And when they approach their children, see if it is more of a conversation. You don't have to convince your child to think or feel in a certain way, but ask, how are you feeling? Do you have any questions for me? And be open and honest with your children about what's happening, but also be very aware. A parent needs to be aware of their own emotions. It's really important to be a model for calmness.
Yep.
Well, it's important to be open and honest with your children. One of the reasons why you really want to know where your children are at, they may ask questions that the answer won't really help them, right? If they're asking a question about, are we going to be back to normal, in a month, and you don't know the answer to that, well, it's okay to say, I don't know. You don't want to necessarily highlight too much. We have no idea when we'll be back to normal. So you want to be a little judicious about being honest, but making sure you're being mindful about the information that you share with your children. It's important just to be a model, to be calm and to really drive home the point that this can be coped with and life can still be good and positive despite our current restrictions.
That's well said. And I think a lot of times as parents, we have a hard time saying we don't know. And it's tricky how we communicate, how we don't, what it is we know and what it is we don't know. So thank you for sharing that. I hope that's helpful to parents watching out there.